Good evening. Am I audible? If I'm audible, can I see a thumbs up in the live chat, please? Okay. So, good evening, Div. So, if you're joining the session for the first time, this is Good Evening Cricket Live. Thanks all for the confirmation. So, if you're joining the session for the first time, this is Dr. Shanmugapriya. I'm Professor and Head of the Department of Biochemistry at Government Thoothukudi Medical College, and I'm your Unacademy educator for Biochemistry. Thank you, Cricket Live. Good evening, Sanjay. Good evening, Kumar. Good evening, Jerry. So in this session, I will be discussing about rate-limiting enzymes of various pathways, and I will also be discussing about regulation of various pathways. And the reason behind why I chose this topic is because I find that students are very apprehensive about regulation, right? So I feel if you have few thumb rules regarding regulation of metabolic pathways, answering any question related to regulation will be a cakewalk. So today I will be telling you all rate limiting enzymes and about shortcuts that you can use to remember regulation of all these metabolic pathways. Good evening, Anshul. Hi, Haragopal Kalluri. So this is an introduction to what you can expect in this session, and before we start the session, let me tell you a few facts about Unacademy's plans. So for you to ace your preparation with top educators, currently there is an offer that is going on. It is 20% off. Hi Tabassum. So there is a 20% off that's happening for all NEET PG subscription plans, and this offer ends tomorrow at 12 p.m. Hi Jitendra. So try to utilize this offer, and to get this offer you can use any educator's code. You can use my code, which is C Shanmugapriya. Yeah, that is my name. So that code can be used to avail 20% off. And for FMG aspirants, I'm assuming that, hi Vignesh, I'm assuming that most of your FMG aspirants, so for you all there is a batch that is starting tomorrow on September 16th. And this is a well-structured batch with all 19 subjects which are covered by top educators. It will be a live interactive session. And the advantage of attending a live interactive session is that you can get your doubts clarified real time. Okay, and not just live session, even if you miss those live sessions, there are recorded sessions that are available which you can watch later. And PDF notes are also available, and you also have an access to Question Bank 2.0. And all these batches are available at an offer price now. It is 9,999. And currently we have, as I told you, we have just released Question Bank 2.0. This has got many case-based MCQs, because I hope you all know that FMG exam, the pattern has changed tremendously, right? There is a paradigm shift in how questions are being asked in FMG question paper. So this Question Bank 2.0 will be of great use to you all, because most of the questions here will be case based, and a detailed explanation will be provided for every question. So conceptual understanding of every subject is possible if you use this Question Bank. And there is a Med Scholar grant test on September 18th at 9 a.m. and you'll be able to win up to 100% scholarship. And I always say this, it's not just about the scholarship or not just about the prize that you win. If you attend this national level scholarship grant test, you will be able to understand why exactly you stand, what is the level of preparation that you have undergone so far, so that you can fine tune your preparation. So I strongly recommend that all of you participate in this grant test. Seen my topic vitamin. Awesome. Thank you Anshul. I'm happy that you enjoyed those two topics. So I'll be taking few live YouTube sessions soon. You can watch all those sessions. Okay. So apart from this, we have NEET PG 2023 integrated and system wise batch, which is starting on which started on August 25th. The duration of this course is 5 months. And again, it will be integrated clinical revision session. Dual educator sessions will be conducted. It's conducted in 3 modules. Okay. So that's all about Unacademy's plans. And this is the first question for today evening. Okay. It's a very simple question, a very straightforward question. Try to answer this. The rate limiting enzyme of glycolysis is it phosphofructokinase 1? Can I see the live chat to be active, please? Yeah. Can you start answering? Is it choice A, choice B, C or D? Glycogen phosphorylase, glycogen synthase. Very good. Jerry has given an answer. It is choice A. Can all of you try to answer this? Good, Jay. Good, Geeta, Div, excellent. So what is the right answer here? The right answer here is phosphofructokinase 1 or choice A. Ashok, this is not choice B. Choice B of fructose 1,6-bisphosphatase is the rate limiting enzyme of gluconeogenesis. Do you understand this? It's gluconeogenesis. And glycogen phosphorylase is the rate limiting enzyme of glycogenolysis. And as the name indicates, glycogen synthase is the rate limiting enzyme of glycogen synthase. Yeah, it is synthesis. Synthase tells you it's a rate limiting enzyme of glycogen synthesis. So now I am going to help you by filling up this tabular column. Thereby you will be able to understand and memorize all rate limiting enzymes. So what are the pathways in carbohydrate metabolism? Yeah, pathways in carbohydrate metabolism will start with glycolysis, right? We are going to start with glycolysis, and then we have citric acid cycle. Yeah, because in glycolysis what do? We convert glucose into pyruvate. So I always say this whenever I start a session. I don't expect you to know even the A's and B's of biochemistry to understand my sessions. Okay, because I will be telling you from the very basic fact. I will explain every concept. But if I tell you a fact, I want you to memorize it immediately. Is that clear? So if I say in glycolysis you convert glucose into pyruvate, I want each and every one of you to remember that. So that is done in glycolysis. And then we have citric acid cycle. We have glycogen synthesis. We have glycogenolysis. And finally gluconeogenesis. So tell me, what are the pathways about which we are going to discuss now? Glycolysis, citric acid cycle, glycogen synthesis, glycogenolysis and gluconeogenesis. Okay. So first fact that I want you all to remember is gluconeogenesis is a reversal of glycolysis. Do you understand this? Gluconeogenesis is a reversal of glycolysis, because in glycolysis, as I told you, you convert glucose into what? Please type that as an answer. In glycolysis, you convert glucose into 2-pyruvate. Whereas what is that we do in gluconeogenesis? In gluconeogenesis, you start with pyruvate and you convert them into glucose. So what is that you are going to remember now? Glycolysis and gluconeogenesis are reversal of each other. Now what is the rate limiting enzyme of glycolysis? In glycolysis, you have an enzyme phosphofructokinase 1. And this phosphofructokinase 1 converts fructose 6-phosphate to fructose 1,6-bisphosphate. Yeah, phosphofructokinase 1 converts fructose 6-phosphate to fructose 1,6-bisphosphate, and that is the rate limiting enzyme of glycolysis. So what do you think will be the rate limiting enzyme of gluconeogenesis? Gluconeogenesis rate limiting enzyme should be reversing this. So which enzyme do you think reverses phosphofructokinase 1 step? It is fructose 1,6-bisphosphatase. Do you understand this? It is fructose 1,6-bisphosphatase, which is the rate limiting enzyme of gluconeogenesis. Okay. It is not Pepsi K, Anshul. It is fructose 1,6-bisphosphatase, which is the rate limiting enzyme of gluconeogenesis. I am happy that you remember that Pepsi K is also an enzyme of this pathway, but it is fructose 1,6-bisphosphatase. Okay, and for citric acid cycle, it is isocitrate dehydrogenase. Please remember, citric acid cycle has got citric, right? So have that in mind. What is the enzyme? It is isocitrate dehydrogenase. Glycogen synthesis, give a logical name. What do you think will be the enzyme which will be limiting the pathway of glycogen synthesis? It is glycogen synthase. It is easy to remember, right? It is glycogen synthase. And for glycogenolysis, it is glycogen phosphorylase. What is it? It is glycogen phosphorylase. So can we memorize this list? So from now on, anytime you are asked, you should be able to answer all this. Okay. So I am going to repeat this for your benefit. For glycolysis, it is phosphofructokinase 1. Gluconeogenesis is reversal of glycolysis. So the enzyme which reverses phosphofructokinase 1 will be the rate limiting enzyme of gluconeogenesis. So that is fructose 1,6-bisphosphatase. For citric acid cycle, citric, that gives you a clue. It is isocitrate dehydrogenase. Glycogen synthesis, it is simple glycogen synthase. For glycogenolysis, it is glycogen phosphorylase. Is that clear? So these are the rate limiting enzymes of carbohydrate metabolism. Is it not very simple? Yeah, so tell me what is the right answer here. The right answer here is choice A, which is phosphofructokinase 1. Okay. Now the next simple question, again a simple question, and if you are asking me, when you know that the topic is just regulation, why are we asked to remember products? Yeah, because only when you know products of a pathway, you will understand the regulation. Is that clear? Only when you know products of a pathway, you will understand the regulation. So many of you are answering it as C. Good. Good Anjali, good Samriddhi, good Div. Likhit has answered it as pyruvate. So anaerobic glycolysis, listen to this, which is the product of anaerobic glycolysis? It is lactate. Okay, so I want you to know that glycolysis can happen both aerobically and anaerobically. If glycolysis happens in the presence of oxygen, aerobic glycolysis, products formed are 2 pyruvate and 7 ATPs. Please memorize it right away. So what are the products of aerobic glycolysis? It is 2 pyruvate and 7 ATPs. Whereas when the same process occurs in the absence of oxygen, in anaerobic glycolysis, what are the products you get? Products in anaerobic glycolysis will be 2 lactate and 2 ATPs. Can you memorize it? Yeah, aerobic glycolysis is 2 pyruvate and 7 ATPs. Anaerobic glycolysis is 2 lactate and 2 ATPs. Okay, so if it is anaerobic glycolysis, the lactate that is formed will reach the liver. Do you understand this? If it's anaerobic glycolysis, wherever it happens, it can happen in RBCs, it can happen in any cell in the absence of oxygen, but wherever lactate is generated, from there lactate will reach the liver. Okay, whereas if it's aerobic glycolysis, what will happen to pyruvate? This pyruvate gets converted to acetyl-CoA. Can you all memorize it? If it's aerobic glycolysis, pyruvate gets converted to acetyl-CoA. And what is the fate of this acetyl-CoA? Can anyone answer that in the chat box? This acetyl-CoA, excellent Dr. Karthik, is this acetyl-CoA gets into citric acid cycle. And when it gets into citric acid cycle, what will you get as a product? The greatest advantage of citric acid cycle is that anything which gets into citric acid cycle will come out as carbon dioxide. Do you now understand why we are interested in knowing about citric acid cycle? Because any fuel which gets into citric acid cycle can come out as carbon dioxide, and that is what we want because we can exhale out carbon dioxide. So this is called as a complete oxidation process. Do you understand this? Is called as complete oxidation process. So tell me what happens to the fate. Yeah, what is the fate of any glucose which you consume? Any glucose which you consume will go through glycolysis, gets converted to pyruvate. Pyruvate gets converted to acetyl-CoA. Acetyl-CoA gets into citric acid cycle, comes out as carbon dioxide. And in every citric acid cycle, how many ATPs do you get? In every citric acid cycle, you get 10 ATPs. So far, I've told you 3 numbers related to ATPs. I'm going to help you recollect that. Aerobic glycolysis gives you 7 ATPs. Anaerobic glycolysis gives you 2 ATPs. Citric acid cycle gives you 10 ATPs. Is that clear? Yeah, Sumitra Mandal has got a good answer. She has answered it as 32. I will tell you about 32 later on. Yeah, for now it is not 32. Don't have 32 in your mind. Just have aerobic glycolysis 7. Anaerobic glycolysis it is 2. Citric acid cycle it is 10 ATPs. Okay. Now if this is the fate of carbohydrate, what is the fate of fat? Yeah, what happens when you are consuming a fat diet? Fatty acid, right? So this fatty acid on oxidation, whatever may be the fatty acid that is present in the diet, that gets oxidized to form N/2 acetyl-CoA. Don't you know that? N carbon atom containing fatty acid. Suppose it's a 16 carbon atom containing fatty acid. Say it is palmitic acid. This palmitic acid undergoes beta oxidation to form 8 acetyl-CoA. So not only carbohydrates, even fat on oxidation would give rise to acetyl-CoA. That acetyl-CoA also gets into citric acid cycle. That also comes out as carbon dioxide. That will also give rise to ATP. Now what if it's a protein diet? Protein diet will give rise to amino acids. And what is the fate of these amino acids? All amino acids on oxidation. Please continue watching the series of lectures for FMGE. Yeah, I will be telling you in detail about what happens to every amino acid. For now, all amino acids on oxidation either give rise to a glycolytic intermediate. They either give rise to a glycolytic intermediate or they give rise to a citric acid cycle intermediate. In either case, they all come out as carbon dioxide. They all give rise to ATP. Is that clear? Are you clear about the outline of metabolic integration that happens in your body? Yeah, the take home message here is whatever may be the diet that you take, it can be a carbohydrate diet, it can be a lipid diet, it can be a protein diet. All these diets will get digested to form glucose, fatty acid and amino acid. Glucose, fatty acid, amino acid get absorbed into the circulation. When they get metabolized, they all get metabolized only through citric acid cycle, giving rise to carbon dioxide which you exhale out and ATP. Okay, so this is an outline. So now tell me the answer for this question. I hope now you don't have any doubts. Yeah. Anaerobic glycolysis, what are the products? Anaerobic glycolysis product will be 2 lactate and 2 ATPs. So what is the right answer here? The right answer here is lactate. Good, Anshul. I am happy that you have understood. Now this is the next question. Only to build a foundation, yeah, only for you to understand the background that is necessary for you to answer this question. I told you about products of all these pathways. Okay, so all the following inhibit phosphofructokinase 1 except. Can anybody try answering this? Excellent, Anjali. Very good. Anjali has given an answer, insulin. Does Anjali have a reason behind it? Good, Dr. Karthik. Rashid has answered it as citrate. Sumitra has answered it as C, insulin. Yeah, all of the following inhibit phosphofructokinase 1 except the answer should be insulin. Okay, if you're asking me, very good, Anjali, excellent. Yes, you're right. So fed state, insulin is anabolic hormone. I am very happy that most of you have understood the crux. Okay, so let me tell you how to answer such questions whenever the question is about regulation of an enzyme. Okay, whenever the question is about regulation of any enzyme, there are 4 questions that I want you to ask yourself. Yeah, 4 questions. The first question is, which pathway is the enzyme related to? Yeah, first question that you should ask yourself is, which pathway is the enzyme related to? Second question is, you should ask yourself, what is the product of this enzyme? Try to find out what is the product of this enzyme. And the third question is, does this enzyme increase or decrease blood glucose? You should ask yourself, does this enzyme increase or decrease blood glucose? The last question is it an anabolic enzyme or is it a catabolic enzyme? Okay, as Karthik has rightly answered it as, anabolic hormone will stimulate anabolic enzymes. So are you clear about these 4 questions? I will tell you why you should ask these questions. For now, what are the 4 questions? First, find out which pathway does this enzyme belong to. Number 2, what are the products of that enzyme? Number 3, does this enzyme increase or decrease blood glucose? Number 4, is it an anabolic or a catabolic enzyme? Okay, now the first 2 questions are interrelated. Do you understand this? These 2 questions are interrelated because when you know the pathway, you will know the product. But why should you know the product? It is because every enzyme gets inhibited by its products. Do you all understand this? Every enzyme gets inhibited by its products. And every enzyme will be stimulated by the substrates. Is that clear? Yeah, that is why you should find out which pathway does it belong to, what are the products. Once you know the products, you know all these products will inhibit that particular enzyme. Okay. Now, why should you know whether the enzyme increases or decreases the blood glucose? Listen to this carefully. Because if it's an enzyme which increases blood glucose, it will be stimulated by which hormone? Can anybody tell me the answer for this question? If it's an enzyme which increases blood glucose, it will be stimulated by which hormone? Will it be stimulated by glucagon or by insulin? I hope you all know that glucagon increases blood glucose, insulin decreases blood glucose. So if it's an enzyme which increases blood glucose, it will be stimulated by glucagon, and that will be by phosphorylation. Do you understand this? That will be by phosphorylation. This is because glucagon always acts through a kinase. Do you understand this? It is because glucagon acts through a kinase. So what happens? What if it's an enzyme which decreases blood glucose? Can you all answer? If it's an enzyme which decreases blood glucose, it will be stimulated by which hormone? It will be stimulated by insulin, and that will be by dephosphorylation. Insulin always acts by dephosphorylation because insulin acts through a phosphatase. Are you clear about these facts? Yeah, because insulin acts through a phosphatase. So if it's an enzyme which increases blood glucose, it is stimulated by glucagon by phosphorylation. If it's an enzyme which decreases blood glucose, that will be stimulated by insulin by dephosphorylation. Okay. Now what if you do not know whether it increases or decreases blood glucose? In that case, try to anabolic enzyme or a catabolic enzyme. So what if it's an anabolic enzyme? Can anybody answer this? Anabolic enzyme will be stimulated by which hormone? All anabolic enzymes will be stimulated by insulin, which is an anabolic hormone. So all anabolic enzymes will get stimulated by dephosphorylation. Do you understand this? All anabolic enzymes get stimulated by dephosphorylation. Whereas if it's a catabolic enzyme, all catabolic enzymes will be stimulated by the catabolic hormone glucagon. So that will be by phosphorylation. Are you clear about this? So now do you understand why I asked you to ask yourself those 4 questions? So what are the 4 questions I told you? The first question which I told you is, what is the pathway that it is related to? So what are the products? So why should you know these 2 facts? Because all products inhibit an enzyme, all substrates stimulate an enzyme. Second set of questions, does it increase or decrease blood glucose? Is it an anabolic enzyme or is it a catabolic enzyme? Why should you know this? If it increases blood glucose, it is stimulated by phosphorylation. If it decreases blood glucose, it gets stimulated by dephosphorylation. Anabolic enzymes will be stimulated by anabolic hormone insulin by dephosphorylation. Catabolic, very good Dr. Karthik, excellent. Whereas catabolic enzymes will be stimulated by glucagon by phosphorylation. Okay, so with this background, can we have a look at the same question again? Yeah, I want you to look at the same question. All the following inhibit phosphofructokinase 1. What is the first question? Pathway. Yeah, first question is pathway. Which pathway is it related to? It is related to glycolysis. And what are the products of glycolysis? Just now I told you it forms pyruvate. Right, it forms pyruvate. From pyruvate, what is that you get? You get citrate. From pyruvate and citrate getting into citric acid cycle, you get ATP. Okay, so you know phosphofructokinase 1 is inhibited by citrate and ATP. Is that clear? Phosphofructokinase 1 is inhibited by citrate and ATP. So we know citrate and ATP are inhibitors. My next question to you is, phosphofructokinase 1, does it increase or decrease the blood glucose? Can any one of you tell me the answer? Phosphofructokinase 1 uses glucose, right? Glycolysis uses glucose, so it decreases blood glucose. If it decreases blood glucose, it is stimulated by which hormone? Can you all answer? If it decreases blood glucose, it is stimulated by which hormone? It is stimulated by insulin. Right, by dephosphorylation, insulin by dephosphorylation. So phosphofructokinase 1 is stimulated by insulin. It is not inhibited by insulin, it is stimulated by insulin. and it is stimulated by dephosphorylation, which means it is inhibited by phosphorylation. Is that clear? Yeah, so what is the right answer for this question? Right answer for this question is insulin. Insulin stimulates phosphofructokinase 1 because it knows, because the hormone insulin knows, if I stimulate phosphofructokinase 1, glycolysis will be stimulated. I will be able to push glucose into the cells, thereby I can reduce the blood glucose. Okay, so answer is C. It's simple, right? So if you try to approach any question logically, if you try to approach any question logically, you will be able to answer it. Okay, so don't try to jump to an answer immediately. Look at all the choices and then try to find out the right answer. Okay. Now that's about carbohydrate metabolism, rate limiting enzyme, and about regulation. Okay. Now fat metabolism, lipid metabolism. The rate limiting enzyme of fatty acid oxidation is. What do you think is the right answer? The rate limiting enzyme of fatty acid oxidation. Anjali says it's choice A. Acetyl-CoA carboxylase is the answer given by Anjali. Anyone else? Others, is it choice A, B, C or D? Karthik also thinks it's choice A. Samriddhi thinks it's choice D. So can I tell you a shortcut here? Yeah. The shortcut is, if you see two of the choices to closely resemble each other. Yeah, if you see two of the choices to closely resemble each other, be suspicious of those choices. One of those will be the right answer. Do you get my point? Here, don't you think carnitine acyltransferase 1 and carnitine acyltransferase 2 are similar? Yeah, so you should be suspicious of these two choices. One of the two is the right answer. So what is the right answer here? Very good, Ravi Teja. The answer here is carnitine acyltransferase 1. The rate limiting enzyme of fatty acid oxidation is carnitine acyltransferase 1. And I will give you clues to remember this. Okay. So in lipid metabolism, what are the pathways? First it is fatty acid synthesis. Okay, first it is fatty acid synthesis. Very good. And then we have fatty acid oxidation. And then we have cholesterol synthesis, which is frequently asked in FMGE. Yeah, cholesterol synthesis. And then we have bile acid synthesis. Finally, it is ketone body synthesis. So what are the pathways that you should know about? Fatty acid synthesis, fatty acid oxidation, cholesterol synthesis, bile acid synthesis and ketone body synthesis. Okay. So first about fatty acid synthesis. What is the building block of fatty acid? Can anybody tell me? What is the building block of fatty acid? Acetyl-CoA. So please understand this. Multiple acetyl-CoA molecules condense to form a fatty acid. Similarly, this fatty acid on oxidation will give rise to acetyl-CoA. I want every one of you to know this. So multiple acetyl-CoA molecules. When two acetyl-CoA molecules combine, you call it as butyric acid. When two butyric acid combine, you call it as octanoyl-CoA. When two octanoyl-CoA combine, you get a long chain fatty acid, which is palmitic acid. So what is the building block of fatty acid? It is acetyl-CoA. Fatty acids on oxidation will give rise to acetyl-CoA. So if acetyl-CoA is the building block of fatty acid, what do you think will be the rate limiting enzyme? It will be acetyl-CoA carboxylase. Do you understand this? So tell me, what is the rate limiting enzyme of fatty acid synthesis? You should remember that the building block is acetyl-CoA. So it has to be acetyl-CoA carboxylase. Now about fatty acid oxidation, I have a question for you. Where does fatty acid oxidation happen? Do you think fatty acids get oxidized in cytoplasm or in mitochondria or in endoplasmic reticulum or in nucleus? Where do you think fatty acids get oxidized? Most of the oxidation processes happen in mitochondria. So please remember, most of the fatty acids get oxidized in mitochondria. And as fatty acid, it cannot cross the mitochondrial membrane. Fatty acid needs a carrier to cross the mitochondrial membrane. What is the carrier? It is carnitine. So this was also asked recently. What is the carrier for fatty acid to get into mitochondria? It is carnitine. So what is the rate limiting enzyme of fatty acid oxidation? It is carnitine acyl transferase 1. Do you understand this? The rate limiting enzyme of fatty acid oxidation is carnitine acyl transferase 1. Is it not easy? If you link that way, it is easier to remember. Just remember, fatty acid oxidation happens in mitochondria. I cannot just like that transport fatty acid across the mitochondrial membrane. I need a carrier. What is the carrier? Carrier is carnitine and the enzyme is carnitine acyl transferase 1. Okay. Cholesterol synthesis. How many of you have learnt about statins? I think the answer was already given by Anjali. Yeah, how many of you have learnt about statins? Yeah, statins reduce blood cholesterol level. How do they reduce blood cholesterol level? Because they inhibit HMG-CoA reductase. What do they inhibit? They inhibit HMG-CoA reductase. Okay. So, Sumitra, you have to be very careful about those mnemonics. Yeah, it is carnitine acyl transferase 1. It is not CPS. CPS is the rate limiting enzyme of urea cycle. So, don't get confused here. Okay. So, statins act by inhibiting HMG-CoA reductase. So, cholesterol synthesis, what is the rate limiting enzyme? It is HMG-CoA reductase. Okay. Now, at this point, please remember that initial few steps of cholesterol synthesis and ketone body synthesis are one and the same. Yeah, initial few steps of cholesterol synthesis and ketone body synthesis are one and the same until HMG-CoA is formed. After HMG-CoA is formed, HMG-CoA reductase will convert HMG-CoA to cholesterol. Whereas HMG-CoA lyase will convert HMG-CoA to ketone bodies. So tell me, what is the rate limiting enzyme of ketone body synthesis? For ketone body synthesis, it is HMG-CoA lyase or HMG-CoA synthase. Okay. Bile acid synthesis. Do you all know that hydroxylated forms of cholesterol is bile acid? All of you? Very good, Anjali. Do you know that hydroxylated forms of cholesterol is bile acid? So you need a hydroxylase. And which hydroxylase is it? It is 7-alpha hydroxylase. Yeah, 7-alpha hydroxylase is the rate limiting enzyme of bile acid synthesis. Yeah, so that's all about rate limiting enzymes of lipid metabolism. Okay, so I'm going to repeat it. The first pathway that you should learn about is fatty acid synthesis. How will you remember? Building block of fatty acid is acetyl-CoA. So the enzyme is acetyl-CoA carboxylase. Fatty acid oxidation, you need a carrier. What is the carrier? Carnitine. And it is carnitine acyl transferase 1. Yeah, carnitine acyl transferase 1 is the rate limiting enzyme of fatty acid oxidation. Cholesterol synthesis, remember statins. Statins inhibit HMG-CoA reductase, thereby they reduce the blood cholesterol level. So the rate limiting enzyme of cholesterol synthesis is HMG-CoA reductase. Bile acid synthesis, you have to hydroxylate cholesterol to form bile acid. So the rate limiting enzyme of bile acid synthesis will be 7-alpha hydroxylase. And then you have ketone body synthesis. Just remember, cholesterol synthesis, ketone body synthesis are similar in multiple ways. The rate limiting enzyme for cholesterol synthesis is HMG-CoA reductase, whereas for ketone body synthesis it is HMG-CoA lyase or HMG-CoA synthase. Do you understand this? It's either HMG-CoA lyase or HMG-CoA synthase. Both hold good. Both are right answers. Okay, they're same. So that's all about rate limiting enzymes of lipid metabolism. So tell me, what is the right answer? Now you should not get confused. Yeah. So for fatty acid oxidation, what is the rate limiting enzyme? It is carnitine acyl transferase 1. Good. Now the next question. This question you should be able to answer because now you know everything about acetyl-CoA carboxylase, right? So good. I'm happy that many of you are giving right answers. So acetyl-CoA carboxylase is stimulated by what? What is the first question, all of you? What is the first question? Excellent. Answer is right. Anjali, you're already right. Yes. So acetyl-CoA carboxylase. What is the first question? The first question is which pathway? What is the pathway? It is fatty acid synthesis. Okay, so what is the product? The product will be fatty acid or acyl-CoA. Okay, does it increase or decrease blood glucose? Even if you don't know, does it increase or decrease blood glucose? Is it an anabolic enzyme or a catabolic enzyme? Fatty acid synthesis is anabolic. Very good, Anjali. It's an anabolic enzyme. If it's an anabolic enzyme, it is stimulated by which hormone? All anabolic enzymes will be stimulated by insulin. Yeah, by dephosphorylation. Insulin by dephosphorylation. So acetyl-CoA carboxylase is stimulated by, what is the right answer? Now do you know the answer? It is stimulated by insulin. Yeah, it is not by phosphorylation, it is by dephosphorylation. So any question, you don't have to memorize answers for any MCQ. However twisted the question is, if you are able to answer these 4 questions, you will be able to answer any question on regulation of a pathway. Okay. Next question. Carnitine acyl transferase 1 is stimulated by all except. Again, answer my first question. Which pathway does it belong to? Carnitine acyl transferase 1 is a rate limiting enzyme of fatty acid oxidation. Right. So what is the product of fatty acid oxidation? It is acetyl-CoA. And what is the substrate? Substrate will be fatty acid or acyl-CoA. Right. Substrate will be acyl-CoA. Acyl-CoA being the substrate, of course, it stimulates carnitine acyl transferase 1. And fatty acid oxidation does not only produce acetyl-CoA as a product, it also provides energy as a product, right? Why will you oxidize fatty acid? To get energy. So energy being a product will inhibit carnitine acyl transferase 1. Do you understand this? ATP being a product will inhibit carnitine acyl transferase 1. And then is it an anabolic enzyme or a catabolic enzyme? Answer this question. It's a catabolic enzyme. When you know it is a catabolic enzyme, it is stimulated by which hormone? It is stimulated by glucagon. Right? It is stimulated by glucagon by what? It is stimulated by glucagon by phosphorylation. Yeah, it is stimulated by glucagon by phosphorylation. So the question is, it is stimulated by all except. Yeah, so there are multiple answers here. So first you know insulin inhibits carnitine acyl transferase 1, right? So insulin is not a stimulator. So choice B is the right answer. Now look at choice A. Choice A is a product, so it is also an inhibitor. So choice A is also a right answer. Okay, and then dephosphorylation, that is also a right answer because you know it gets stimulated by phosphorylation. So the question should have been carnitine acyl transferase 1 is stimulated by what? If the question was this, then what will be your answer? Carnitine acyl transferase 1 is stimulated by what? It should be stimulated by its substrate. What is its substrate? Acyl-CoA. If the question was carnitine acyl transferase 1 is stimulated by, then your answer should be acyl-CoA. So why am I telling you all these facts? Yeah, this is the basis of keto diet. How many of you have heard of keto diet or ketogenic diet? How many of you have heard of keto diet or ketogenic diet? All of you? Yeah. So what is keto diet or ketogenic diet? That will expect you to thrive on zero carbohydrate, high fat diet. And they say that helps in weight loss. And if you're asking me how can a high fat diet help in weight loss? Because if you're on a high fat diet, acyl-CoA availability will be high. Fatty acid or acyl-CoA availability will be high. When acyl-CoA is high, it goes and stimulates fatty acid oxidation. So any fatty acid which the person has stored so far, yeah, any fatty acid which the person has stored so far will be oxidized. So the person is going to burn his or her fat, and that is how it helps in weight loss. And this is why understanding biochemistry is essential for you to understand so many clinical correlation. Okay, so how does keto diet help in weight loss? Because keto diet is zero carbohydrate, high fat diet. High fat diet will have high acyl-CoA availability. Acyl-CoA will stimulate carnitine acyl transferase 1. okay, will stimulate carnitine acyltransferase 1, and that will result in fat loss. Okay, so what is the answer for this question? It is stimulated by all except we have multiple answers here. We have choice A, choice B and choice D. Okay. Now this is the next question. The rate limiting enzyme of urea cycle is. What do you think is the right answer? The rate limiting enzyme of urea cycle is. I gave you clue previously. What did I tell you? Whenever you see two choices to sound similar, you have to be suspicious of those two choices, right? So here carbamyl phosphate synthetase 1 and carbamyl phosphate synthetase 2 sound similar. And what is the right answer? The right answer is carbamyl phosphate synthetase 1. And that is why mnemonics or shortcuts should be learnt properly. For fatty acid oxidation, it is carnitine acyltransferase 1. For urea cycle, it is carbamyl phosphate synthetase 1. Is that clear? It is carbamyl phosphate synthetase 1. So what is carbamyl phosphate synthetase 2? Carbamyl phosphate synthetase 2 is the rate limiting enzyme of pyrimidine synthesis. Yeah, please remember, carbamyl phosphate synthetase 1 is the rate limiting enzyme of urea cycle. Carbamyl phosphate synthetase 2 is the rate limiting enzyme of pyrimidine synthesis. And I know many of you would be blinking at me. You are staring at me saying that no, I have learnt aspartate transcarbamylase is the rate limiting enzyme of pyrimidine synthesis. You are giving a different answer. So you will have two answers here. Carbamyl phosphate synthetase 2 and aspartate transcarbamylase are two activities of the same enzyme. Do you understand this? Carbamyl phosphate synthetase 2 and aspartate transcarbamylase are two activities of the same enzyme, and that is the rate limiting enzyme. So both these can be right. So what is the rate limiting enzyme of pyrimidine synthesis, all of you? For pyrimidine synthesis, it is carbamyl phosphate synthetase 2 / aspartate transcarbamylase, both of which are two activities of the same enzyme. Okay. Now how about glutamine PRPP amidinotransferase? Glutamine PRPP amidinotransferase is the rate limiting enzyme of purine synthesis. Okay, glutamine PRPP amidinotransferase is the rate limiting enzyme of purine synthesis. Okay, so what is the right answer here? The right answer here is for urea cycle, it is carbamyl phosphate synthetase 1. Okay. Do you have any doubts here? For purine synthesis, it is glutamine PRPP amidinotransferase. For pyrimidine synthesis, it is carbamyl phosphate synthetase 2 or aspartate transcarbamylase. Okay. Now this is the last question for today's session. All of the following are true about carbamyl phosphate synthetase 1 except. Yeah, the question is about the rate limiting enzyme. What did I tell you about CPS1? I said it's the rate limiting enzyme of which pathway? It's the rate limiting enzyme of urea cycle. And can you all tell me what does urea cycle do? Urea cycle helps in detoxification of ammonia to form urea. So for those of you who do not know about urea cycle, in your body amino acids get oxidized. And whenever amino acids get oxidized, they release toxic ammonia. Ammonia is toxic because it is toxic to neurons. It causes metabolic encephalopathy. So as and when ammonia gets generated because of amino acid catabolism, you should immediately convert ammonia to urea. And that is done by urea cycle. And this urea cycle happens in liver. Do you understand this? Urea cycle happens in liver. So this is an introduction to urea cycle. Okay. Now the question is about CPS1, which is the enzyme of urea cycle, and this enzyme is present in mitochondria, which is a true answer, which is a right answer. It is present in mitochondria. And for CPS1 is ammonia the nitrogen source. What do you all think of that? What is the function of CPS1? Function of CPS1 is to detoxify ammonia. So ammonia will be the nitrogen source. Obviously ammonia will be the nitrogen source. So this is also true. And is CPS1 stimulated by N-acetyl glutamate? Yes. CPS1 is stimulated by N-acetyl glutamate because whenever ammonia gets generated in your body, this ammonia immediately reacts with alpha ketoglutarate to form glutamate. Do you understand this? Whenever amino acids undergo breakdown, whenever ammonia gets released, because ammonia can be detoxified finally only in liver. Yeah, it can be detoxified only finally in liver. But what you're supposed to do is you're supposed to convert ammonia into a non-toxic form and it should be transported to the liver. So in which form is ammonia transported? Ammonia is transported as glutamate. So what is the signal for ammonia genesis? All of you tell me. The signal for ammonia genesis is glutamate. Yeah, if that is the signal for ammonia genesis, it should stimulate urea cycle. How does glutamate stimulate urea cycle? Glutamate reacts with acetyl-CoA. It forms N-acetyl glutamate and that N-acetyl glutamate goes and stimulates CPS1. Okay, so now even if you think it's a bit confusing, if I fill up this tabular column, you will be able to understand it better. Okay, so in this tabular column, I am going to tell you the differences between CPS1 and CPS2. And you're going to help me in filling up this tabular column. The first property is which pathway? Tell me which pathway is CPS1 involved in? Yeah, is which pathway, in which pathway CPS1 is involved? It is involved in urea cycle. In which pathway is CPS2 involved? CPS2 is involved in pyrimidine synthesis. Do you understand this? CPS2 is involved in pyrimidine synthesis. That is the first difference. Second difference, where is it located? Yeah, is it located in cytoplasm or in mitochondria? CPS1, the first enzyme of urea cycle, is present in mitochondria. Whereas CPS2 is present in cytoplasm. Yeah, CPS2 is present in cytoplasm. Third difference also you know. Which is the amino group donor? Which is the nitrogen source? The nitrogen source for CPS1 is ammonia, which we are trying to detoxify. Whereas for CPS2, the amino group source or the nitrogen source will be glutamine. Yeah, for CPS2, the amino group source or the nitrogen source will be glutamine. Very good, Shafiq. Excellent. And the last difference is regulation. So regulation, because CPS1 is involved in urea cycle, which is supposed to detoxify ammonia, and because the non-toxic form of ammonia is glutamate, it is stimulated by N-acetyl glutamate. CPS1 is stimulated by N-acetyl glutamate. Whereas if you look at CPS2, N-acetyl glutamate has got nothing to do with regulating CPS2. But because CPS2 is involved in pyrimidine synthesis, CPS2 will be inhibited by pyrimidine nucleotides. Do you understand this? CPS2 is inhibited by pyrimidine nucleotides. I told you products always inhibit an enzyme. So what are the pyrimidine nucleotides? CUT. The mnemonic that you can have for pyrimidine nucleotides is CUT. What does CUT stand for? Cytidine, uridine, thymidine. So cytidine, uridine, thymidine, all these inhibit CPS2. Okay. So what are the differences between CPS1 and CPS2? Yeah, so tell me, what is the first difference? CPS1 is involved in which pathway? Urea cycle. CPS2 is involved in pyrimidine synthesis. Good. CPS1 is present in mitochondria. CPS2 is present in cytoplasm. For CPS1, the amino group donor is ammonia. For CPS2, the amino group donor is glutamine. Okay, and CPS1 is stimulated by N-acetyl glutamate, whereas CPS2 is inhibited by all its products. What are the products? CUT. What does CUT stand for? Cytidine, uridine and thymidine. Okay, so that's about this tabular column. I hope now it's clear to you about differences between CPS1 and CPS2. Okay. Yeah. So now tell me, true or false? Is CPS1 present in mitochondria? Yes, it is present in mitochondria. Is ammonia the nitrogen source? Yes, ammonia the nitrogen source. Is it stimulated by N-acetyl glutamate? Yes, it is stimulated by N-acetyl glutamate. And this is a false statement because this does not hold good here. This goes and regulates only CPS2. That too inhibition. Uridine, cytidine and thymidine inhibits CPS2. Okay. So that's all about rate limiting enzymes and about regulation. Okay. I hope it was helpful. So after the session, please watch the session again. Yeah, now you might think you have understood it. Okay, but what I would suggest is repetitive revision. Yeah, spaced repetition is all that you need to be able to answer an MCQ based on this. Now you might think you have understood, but more the number of times you listen to this or revise this, you will be able to answer it in your exam. Okay, so all the best. Thank you. See you sometime later. Okay, my pleasure, Dib.